All right, everyone, we are going to go ahead and get started as we have a lot of information to cover during today's panel discussion. Welcome to Forge Health's a panel discussion around cultural identity and mental health. During this time together, we will be talking about some important clinical topics in regards to how this relates to care, but we'll just also be talking about just some information that's really good to know, especially if you are an ally to diverse populations. I would like to let you all know that this panel is being recorded. If you know of anyone that missed or is unable to attend, it will be available on our Forge Health YouTube channel. And literally, if you Google Forge Health YouTube, it takes you right to the YouTube channel. And you'll be able to see all of our discussions that we've held this year around various topics, including oncology, LGBTQ+, as well as culture, identity, and some hot topics there. So this is continuing our panel discussions and our sessions that we've been having here at Forge. So thank you for attending this one. I am really happy to introduce you to our panel today. It is expertise that is all within Forge clinical leadership team. I'm going to start off by introducing Dr. Erica. Dr. Erica is at Forge, our Senior Director of Leadership and Training Development. If you can just wave, Dr. Erica, so everybody can see you. Awesome. The next person that I am going to introduce is Susan. Susan is our clinic director in New Jersey, our West Orange location, where she leads a team of clinicians that offer outpatient services for those that are experiencing mental health as well as substance abuse struggles. Could you wave your hand, Susan? And then last but not least, we have Gallo. Gallo is our executive clinical director in our Philadelphia office. Within the Philadelphia office, we do offer intensive outpatient services as well as outpatient services for those that are also struggling with substance abuse and mental health issues. Gallo also helped start up one of our other locations, which is our Langhorne location in Pennsylvania. And I am very excited to go ahead and start this discussion with Dr. Erica, Susan, and Gallo today. In order to kind of level set and really explain what we mean about cultural identity, because it could be described and defined in so many different ways, I would like the panelists to really start off with sharing how do they define their own cultural identity? Of course, we can look at each of our panelists and assume that they may be of a diverse background, but I would like for them to share how do they define their own cultural identity. I'm going to toss it to Gallo to start us off with.
Okay. Well, I identify as multicultural, multi-ethnic, having Caribbean and South American background. I was born in America, so I also have an American culture. And as a mental health provider, also have a therapist culture. So I think about, the term multicultural and what that really means, aside from an ethnic, racial, or geographic definition, because, I am American and also a mental health provider. So there's many cultures in which I define myself. So that's my perspective.
Gallo. Susan?
So for me, my cultural identity is influenced by a couple of different factors, including my nationality, ethnicity, socioeconomic background, and my religious upbringing. So I consider myself first generation American, meaning I was born to immigrant parents. I am of Dominican descent. I was raised in an inner city and urban environment. So I was born and raised in Jersey City, New Jersey, and completed all of like my high school schooling in Newark, New Jersey. I was from a lower socioeconomic status, and I was brought up in the Catholic faith. So all of those factors really encompass my cultural identity.
Love it. Thank you, Susan. And Erica.
Good afternoon, everyone. To both Gallo and Susan's point of multiculturally and racially, ethnically diverse identities, I do identify as a first generation Caribbean Black American woman. I think when I look or I ascribe to identity, I have to look at first generation because my parents are not of descent of American and Westernized ideology. So I have a very much non-Western, community, collectivistic, group thought, and group learning perspective. Again, I have gone through all of the traditional levels of education up to and including my doctorate degree. So that does impact in terms of my socioeconomic status as well as my socio-political identity, as well as my cultural and ethnic upbringing within North Jersey, and being a part of a multiculturally, ethnically diverse community and neighborhood.
Thanks, Dr. Erica. And I love how all three of you described it and defined it very differently. And that's exactly what cultural identity is all about. It is defined by the person who embodies that. What's fascinating is I remember as a child and as an adolescent, if you was to ask me what is my cultural identity, I would have said I'm a Black person. That's it. That's how I defined myself. But as I became older and more mature, I defined myself and my cultural identity as something very similar to what Susan and Gallo indicated, which is it encompasses many factors of me. One thing that I had to figure out was what does it mean to be a Black woman? And I'm not first generation. And so one way that I was able to do a little bit deeper dive, and some people have mixed emotions about doing this, is through DNA ancestry testing. And once I did that, I was like, like, no wonder I have random blonde hairs that poke out of like my arm, because I have so much mixed in me. No wonder I have random freckles in places because I have a little bit of Irish descent and my children have red hair. And, and once I kind of I felt a little bit more connected to being a Black American because in America it's a lot of mixture. And so that's one thing that helped me kind of define my cultural identity, was doing that piece of it. And then of course, I now accept and I claim my religion and being a mental health professional as a part of my cultural identity as well, my social economic status and so forth. But it really is dependent and defined by the person who embodies that. So sticking with that, I'm curious, as to the panelists, in what ways does cultural identity kind of impact mental health, and how do you see that intersection? How does this whole all kind of relate?
If I could, Dr. Cleo, I would like to kind of start off and lead this conversation, and more so to really couch and frame the remaining time that we have together in the context of really taking into account why and how we look at the intersectionality of mental health and cultural identity in the lens of the history of the United States, more so particularly when we speak on racism and racial discrimination that is systemic and systematic within our institutions, as to why and how that compounds with stress and inequitable access to healthcare. So when I say that or speak to that, I'm more so speaking on racial and structural racism within societies of institutions that are, again, systemically and systematically oppressive to marginalized communities. For example, our criminal justice system, access to equitable education, employment, housing, healthcare. And then we add the component of non-Western and Westernized ideologies of, again, to Western, very individualistic promotion of self-interest versus collectivistic, which is very communal and community oriented. And then we look at, again, through very much validated experience throughout history of the mistreatment of and mistrust within our medical and our healthcare system. So I think that I wanted to really highlight and lead with that in couching and framing our discussion, because if we were to talk about how mental health and cultural identity intersect, we're really missing the elephant in the room to all of those. Again, it is not a comprehensive, inclusive pillar list, but it definitely, all three of those things of structural racism, mistrust within our healthcare system, as well as differing and conflicting ideologies, all play a very prominent impact on one's mental health presentations and symptomologies. So I did want to start off by saying that, but in terms of how does mental health and one's cultural identity intersect, we can really look at, for example, help-seeking behaviors. Oftentimes there are some limitations or barriers of individuals accessing or looking to seek out help due to the stigma associated and surrounding with mental health presentations. Oftentimes in some cultures, it's looked or frowned down upon as though it's a weakness and or shame against and placed upon the family. So I think we also have to have and recognize the stigma that's associated with that, and how does that play into the community and one's culture. Coping mechanisms play a significant role as well when we think about traditional healing practices, whether it's through community support, oftentimes, again, through the litany of the historic implications of our country, there's a very much internal support within communities, within our cultures. So for example, it might be faith-based. A lot of our racially and ethnically diverse clients heavily rely on faith to navigate and help them mitigate some mental health presentations. They actually also may seek informal social networks. For example, a few years ago, I actually did a research study on the experiences on help-seeking behaviors of African-American women with mental health professionals. And I found that one of the key staples that African-American women rely on are hair salons, that it's such a prominent fixture and staple of, rather than outreaching and help-seeking in more so traditional institutions, again, finding solace and refuge within their respective communities. So it's such a very complex response. And again, there's no way that I could speak to all of those key points in about 5 minutes in a response, but those are just some like overarching rhymes and reasons on how these two components of mental health and cultural identity intersect.
If I could add just, and I appreciate everything that Erica, set up and laid down for us to continue the conversation. But I just think an interesting point about intersecting identities is if you are a person that has multiple group memberships, LGBT, your gender differences, ethnicity, your race, etc. How do you find someone who's suitable to, which group are you gonna focus your identity most on and find a person that's suitable and can relate to your issues based on which one of these group memberships, right? Am I Latino first? Am I brown? Am I, heterosexual? Am I homo? Am I trans first? Am I looking at, are my issues related to my gender, more than any other group, group membership that I have? So I think it's interesting to kind of dissect where a person, when they're presenting with issues, what is most important? What do they relate most to in terms of group membership, or what is the most impactful at that moment in terms of symptoms, environmental stresses, factors, and coping? So I think that, me being a member of multiple marginalized groups, that what comes to my mind as a provider, a mental health provider. And then, if I flip it and think in terms of a client, if I was looking for a mental health professional, what is the most significant thing to me, or which group am I is most impactful to my identity, in which I can bring forward or look for a provider that can understand that piece of my identity. So I think that's important also. What am I leading with? My race, my gender, my sexual orientation, or whatever other group membership that I have. So just to kind of, interject that point and that point of view into the conversation.
Yeah, I think Dr. Pinthi really spoke really well on all of those points. I definitely agree that someone who belongs to multiple, let's say, marginalized identities can be at a higher risk for experiencing mental health issues. For example, like to Gallo's point, if you're a person of color and also maybe a member of the LGBTQIA community, you may face some compounded discrimination and stigma when trying to seek out mental health. Dr. Pinthi also brought up a lot of great points with regards to cultural stigmas. Every culture has a different
Mhm.
way of looking at mental health. And sometimes these inaccurate views can make it harder for those struggling to talk about mental health without it being, viewed negatively, and that in turn negatively impacting their decision to seek help. I also think sometimes cultural norms may influence variations in how individuals even communicate their symptoms, ranging from maybe some subtle differences to significant omissions in the symptoms that they choose to disclose. Again, Dr. Pinthi brought up the socioeconomic intersection as far as mental health goes, and how, there's a lot of research out there that shows or suggests that minorities in the United States are less likely to maybe even access treatment for mental
Mhm.
health, or they'll seek help until like when the symptoms are severe at that point.
And it's crisis.
So,
Exactly. Mhm.
right. So there's a lot of things to consider here when considering an individual's approach to seeking treatment for mental health.
Yeah, yeah. I love so many things about what you all just said. And I have to go back to one item, which is when Dr. Erica mentioned the hair salon. So some people know I love playing around with my hair. Like you can see me one day and my hair is up and the
Mhm.
next day it looks completely different. And what's fascinating is it's therapeutic for me to play around with my hair because it reminds me of like going to the hair salon and turning on music. So I usually have music playing in the background. It's very therapeutic. So actually yesterday I went to a hair salon and got my hair done. And as I was actually sitting in the chair, I was like, man, this is like so calming for me. It isn't official, it isn't like therapy, but it's like it's a coping mechanism that I've developed over the years. And I felt so relaxed afterwards just because of the ambiance of the salon and people talking and the interaction and so forth. The other thing that kind of stood out to me, is our emphasis around how do you decide which therapist is best for you, especially if you are a part of various or identify with various marginalized communities? Susan, you brought up that within your definition, your prior socioeconomic status and how you were raised is a part of that cultural identity. I can't help but to think about access to care. So we are working with a lot of individuals that are a part of various marginalized communities, and oftentimes, unfortunately, they're situated in places where it doesn't have the best socioeconomic status. Could you all talk a little bit more about like what we may be seeing in regards to access to care or any potential barriers to care due to being of a diverse background?
Absolutely. Just to speak a little bit on that, in terms of access to care and how your socioeconomic status can influence that. I mean, there are people who don't have insurance to begin with, or their insurance may not be up to par, and so they don't get the best treatment that's out there. They're limited to a certain network of providers, for example. So that could play, a big negative impact on them getting some quality care.
Mhm. And I think even to echo to Susan's point about the quality of care that marginalized persons will receive is that oftentimes they're with the interns, they're with the clinical team that's just now getting into the field. They're being the guinea pigs of fill in the blank. So the quality of care that marginalized groups are receiving is not that of affluent socioeconomic status of the primary and predominant commercialized insurances.
I also
That's a
want to
good point.
point out that there is at times language barriers, or
Mm.
just a lack of cultural sensitivity with treatment. There is at times even discrimination and biases from
Mhm.
within mental health care providers,
Mhm.
which then in turn can lead a client to not want to seek out help or to drop out of treatment early as a direct result of them not feeling understood by their care professionals.
I want to just touch on like the overarching cultural pieces. I mean, we're talking about like service providers and individual experience, but as an overarching ideology, I think Dr. Erica and also Susan touched on some interesting points that I just want to echo and make sure that we're kind of having the forefront. As cultural groups, obviously we discuss stigmas, and the way in which cultural groups approach mental health. You know, some people see it as a sign of strength, others like a sign of weakness, like Erica, you know, prefaced. There's also reluctance to discuss symptoms, right? There's some taboos around certain issues culturally, right? Some can be around gender, around family dynamics, around, you know, particular stresses for individuals. Those things are just not spoken about to strangers, right? We keep that in the family. And Dr. Erica also prefaced that with the kind of the individualistic versus the group-oriented thinking and how that communication happens. So those are two, I think, already established issues with accessing through the cultural lens mental health services, right? The cultural stigmas associated, the reluctance or the taboos around communication you know, in reference to particular circumstances, stresses, triggers, issues, symptoms, etc. Lack of community support. So, you know, we have an overarching cultural perspective about mental health, but the community itself, right? My immediate family, my friends, my environment, my community, my you know, my church, whatever, you know, whatever the case is, whatever groups I'm interacting with in my immediate circle. You know, how acceptable is mental health treatment in those circles? And the immediate, you know, again, you know, places that I'm interacting with, are there cultural stigmas that are reinforced in my immediate social circles? And also the need for relatable resources, people that look like me, that can understand me. I don't want to have to sit, you know, from a client's perspective, sit in a room with a professional and have to explain my point of view based on my culture. There's so many nuances that have to be accounted for that can be exhausting to have to train my professional about how to treat me, right? I feel like the role can be a little reversed. They should be the person kind of sensitive and open to my experience versus me having to train the clinician. So that can be challenging, having to sit and, you know, be vulnerable, but not only be vulnerable with my personal information, then have to train the person that's a professional about how to treat me in my personal issues. So I just wanted to kind of give an overarching, you know, to continue the theme of how culturally these things influence how I may move forward to access care.
And I think both Susan and Gallo speak to the failures of our healthcare system and the barriers that they cultivate for marginalized communities, especially when we're thinking about or speaking to implicit biases of healthcare providers, which lends itself into misdiagnosing, underdiagnosing, as well as inadequate treatment. I actually was having a conversation with a student last night, and her son actually graduated from high school yesterday, and he is a high functioning autistic Black male. And she spoke on her experiences throughout his entire childhood where healthcare professionals were misdiagnosing him for ADHD. And she was like, I work in the school system. I know how ADHD presents, and that's not ADHD. And it took her to see a Black male healthcare provider who was like, no, that's autistic. That's autism right there. And that afforded her opportunities to gain access to the community of autism. So, you know, when you're thinking about implicit biases and failures in the healthcare system, that's a barrier for people. And then you're looking, and I know Gallo spoke about this in terms of all of the different identities that we embody. When you talk about the invisibility of the intersectionality of your identities and how it does not afford a comprehensive treatment to really adequately address all of the compounded issues, stress, and stigmas that clients experience on a day-to-day basis.
I want to also add, you know, that minorities have untreated racial trauma, all right? And how many you know, service providers are trained to assess for racial trauma? Not many, right? We have, I don't want to bring out all the issues, but in the news in the past couple of years, there's just been so much controversy around things that are happening based on race. So are we even talking about, is this even on our radars? I mean, you know, people are traumatized vicariously through watching images on the video. That can be me, that can be you, right? Those things hit a little different when you are a member of that group, right? So I think that also the conversation has to be about this trauma that we as people, you know, through ethnic and racial minorities are facing, and what do clinicians feel about having someone, you know, who has many identities and is struggling with various levels of trauma based on those various identities. So just another piece to keep in mind about how it can be challenging to find someone to treat your issues.
As a clinician listening to this conversation, it may feel very intimidating, right? And I don't want anybody to walk away thinking, well, because I am not of a minority status or I don't have a strong footing in my cultural identity and so forth, I am not equipped to work with X population. So I want to address that. How should, if you have any guidance for clinicians or other types of healthcare providers, what are some ways that they can use cultural identity within the treatment plan?
Mm-hmm. Mm-hmm.
I was going to speak on cultural competency, whether that's being provided as, training in your workplace. What does that look like? That might be educating oneself about the cultural differences and backgrounds, beliefs, and values, both your own, so that you can constantly self-reflect and keep an open mind to learn about your client. Avoid making assumptions or stereotypes based on that person's culture. Um, Again, being willing to learn from others, seeking out opportunities for additional trainings, actively listening and communicating respectively with your clients, and continuously working on improving cultural humility, again, both in our personal and professional lives, being an advocate to your client for inclusivity and just diversity. I think all of those factors can make a difference for your client.
Mm-hmm. Mm-hmm.
Okay.
Gallo.
Yeah, I think that understanding how the experience of racial bias and cultural beliefs about health influence treatment outcomes. Also, what interventions does the person believe and buy into? Are they more open to having like a group setting, individual work? What are the things that they feel may be helpful? Well, we need to ask those questions. Do you think this intervention may work for you? That doesn't make sense to me. It doesn't fit with me as a person, my culture, my identity, my beliefs, my values, right? So that's out the window.
Mm-hmm.
The ideas about gender and culture. Every culture has ideas about gender that can't be excluded. We need to look at the patriarchal systems that are involved in people's religion and the structure of their families, the structure of their communities. Susan brought up earlier about language. When you're talking about immigrant experiences, right? They can be misdiagnosed due to miscommunication, have negative experiences with previous service providers. So those are things to keep in mind as a provider. I think also clinicians should focus on various somatic manifestations. There's research that indicates that people experience through various cultures anxiety in a different way. Some people may get upset stomachs, headaches. Spanish people call it the nervios, which is my nerves, which means anxiety, right?
Yeah.
But there's a different word. They're not saying ansiedad, they're saying nervios, right? But means the same thing. Just a small example to illustrate how communication is important and being open to what the client is bringing. Being aware of your own bias is paramount, right? To misdiagnosis, ignoring symptoms, not understanding your client, and then understanding that minorities, like Susan said earlier, may not come for the one-on-one right away, right? They may be in crisis because they're not seeking individual therapy. They're going to the group, they're going to the family, they're seeking social support, networking, those things. So I think those things are important for a clinician and service provider when having clients that may be different from your culture.
And I think just to add, both Susan and Gallo are echoing just having this environment of continuous learning. We all don't know everything, and we are never going to be the experts of our clients. However, it is our responsibility not to be of disservice to our clients, regardless of who is before us. So recognizing that and taking the initiative to seek out further consultation with your clinical supervisor. If you're within an agency or community agency mental health organization, seek out supervision and consultation with your administrative supervisors or people leaders within the organization. Continuing education units, reading free literature online, always maintaining a sense of humility that you are going to forever be a learner, so that again, you are then equipped. And Gallo brought up a really excellent point of burdening our clients with being the educator of themselves to us. That's not our client. client's responsibility. However, we are to create a safe space of empathy so that if there's something that, you know what, I don't know what that is like for you, but I could only imagine how difficult this experience is for you. As you go, Google something so that, again, by the time you meet with them again in the next week or two, you have some premise, some basic idea and framework to go off of. So again, it's just promoting and living in a space of being a continuous learner.
Right.
I have a couple more things for the clinicians, right? In terms of, you know, tips to treat people who are of a different culture. I think what's interesting to look at is coping styles of different people. So what is a stressor in a cultural context? I mentioned before, somatic manifestation of anxiety in different forms. So how do we understand stress as a culture, right? Is it financial? Is it familial? Is it my neighborhood? What is a stressor? How do I conceptualize that from a cultural frame? Okay. So, you know, also, what are the responses culturally to stresses? Do we run? Do we face it? Do we stay quiet? Right? What are some of the ways as a culture we respond to stresses and to triggers? Okay. And then, you know, treatment seeking patterns. So as a culture, you know, what are the ideas about and the history with mental health? Is there intergenerational access to behavioral health services? You may be first or second generation removed from another country. What does that look like? People in, you know, in another country, what is their, you know, what are their ideas about mental health services and how do they access? The historical context Erica brought up before, right? We use standardized Western assessments that don't account for cultural differences. So what does that look like for someone who's from a different country and not used to the Western system? We're using assessments that, again, are standardized. They may not account for cultural differences, in which case a person is left outside of the assessment, and then we're making a false diagnosis based on an assessment that is not assessing for a person and how they perceive or how they're experiencing a mental health disorder. Also racism, right? The history of trauma, discrimination, stereotyping, mainstream bias, and xenophobia, right? The immigrants, we're scared, right? All this kind of, all these feelings that may be coming out not explicitly, but kind of through our bias, stereotyping, you know, and our feelings in the room, right? Our countertransference. And also gender, I can't continue enough, right? Considering the patriarchal cultures, its impact. Those things I think are important to look at when you're working with someone from a different culture. Again, the coping, you know, the coping style, the treatment-seeking patterns, historical context, racism, gender, and lastly, the immediate family, right? Are they supporters? Are they contributors to the mental health disorder? Are they going to be, you know, a part of the recovery process or a part of the piece that needs to kind of create some space around, right? In order for the person to focus on themselves and be better.
I love it. And what I hear you all consistently telling, you know, our individuals that are part of the session with us is that you do not have to be the expert on everything. The key is remaining open-minded and being willing to learn. Also making sure that the client is kind of leading the experience and not being afraid to ask them questions. I love how one of you phrased it as asking them, does this work for you? Does this intervention work for you?
That's right.
And oftentimes we get so busy with trying to, you know, assist individuals and moving along their recovery journey that we don't stop and pause and ask the question, do you agree with the direction that we're taking this, right? Even just asking that question opens up the room for more conversation. And then understanding yourself as an individual, as a human being. So even if you're not a provider on this call or a clinician or a therapist, it's so important to understand your, as Gallo put it, countertransference, which is basically the reactions that you may have unconsciously towards the environment. And that environment could be people, places, and things. And so it's just important for you to just pause every now and then and just really recognize your reactions to things, your countertransference based upon your own experiences. One thing, Gallo, that you mentioned was the connection to family. A lot of times individuals in care, we see that they are not necessarily connected directly to their immediate family. And we know that connection to family helps influence cultural identity. It makes me start to think about, is there any negative things or difficulties that can come about in treatment when an individual does not have their cultural identity defined yet. And how do you go about recognizing that with a client without upsetting them or without pointing out that they may have some cultural identity work to do? It could feel, I guess, rude if you don't address it in the right way.
Yeah, the first thing that comes to mind to me is if someone is experiencing a little bit of like cultural identity confusion, maybe, or some conflict. Say, for example, they're leaving a religion or reconsidering maybe what they were taught to believe, or they're embracing a new sexual identity of some sort, whether they're migrating to a new country, that can really impact one's mental health. So I think kind of a lot of the points that we've discussed is just keeping that open, safe space of letting the client almost be the leader in processing that and, processing, their feelings with that and how they want to work on, resolving some of those issues.
I wanted to add, from an LGBTQ plus lens, you share everything with your family, music, food, language, religion, and the moment you're LGBT, you're separated from your family. So this idea of does being part of your culture, hurt or help your mental health, I think both ways. It can be both ways. So if I'm separating from an oppressive family system and then having a chosen family that's accepting me and affirming my identity, then that's a good thing. But from an immigrant experience, to the flip side, if I leave a country and I no longer have connection to my culture and I'm somewhere else and having to assimilate to a different culture and losing my, identity, my cultural identity, of my country of origin, that's detrimental. So in some ways, separation, well, I think in both ways, I guess in both examples, separation from family, well, the LGBT was a good thing and the immigrant, it was a bad thing, right? So the LGBT oppressive family, again, finding a new family or a chosen family or chosen cultural understanding, affirming family, right? Will be a good thing, while the immigrant, may suffer through depression, isolation, anxiety, etc., from that distance and separation. So it depends, I think, on each individual case. But I think, overall, connection to culture, I think, is important. The way we get there, I think, is the nuances I'm talking about.
Right. I agree with Gallo that there's like pros and cons to having direct ties with your culture. And you gave really great examples, Gallo.
That's great. So as we lead into Q&A, anyone on the call, if you have questions or thoughts that had came up during this conversation, please feel free to drop something in the chat and we'll be able to circle back around to it within the next couple of minutes or so. I do have one kind of really actually two final questions to the group. My first question is, what are some strategies or resources that are helpful in navigating mental health services from someone that may have a diverse cultural background? So, for example, you could be a clinician or you could be a family member on this call and you want to navigate the mental health system. You want to make sure that the individual is paired with the right person. What is some guidance and advice for you in that situation, or advice for individuals?
I think some things that come to mind for one is research, like researching maybe community-based programs. That might be a good place to start, or at least get, some direction as to where to go. A lot of the times now, mental health has been getting integrated within one's primary care physician. So I think obviously primary care physicians should be assessing for these kinds of things to help start the conversation. And that can be an avenue for getting some help. And also, I think even leveraging technology now and apps can be beneficial for those who may face certain barriers, whether that's, maybe transportation is an issue for you. Now with technology, that can be very like a helpful and beneficial tool for diverse populations or anyone experiencing certain barriers. This could be, a good adjunct to the traditional mental health route, might serve with some benefit.
Erica?
I think even to echoing Susan's point, if you are, or if one is connected to their community leaders, to accessing and providing them good direction into where are some possible economic hardship to like institutions so that they could gain access to affordable health care, what are community agencies that are prominent to their primary or native tongue or language, accessing people, places, and things within their community that is, again, much more affordable, and even leveraging, again, technology when it comes to using telebehavioral health services are all great starting points to provide some additional support or resources or just direction of where to just start the process of accessing healthcare.
Gala, what are your thoughts?
I agree with everything they said. I think that, it's about getting, into the communities and really about access. I think I'm going to echo the same thing that they both said. So I think you both spoke to the point
Yeah.
efficiently. I don't think I have anything to add.
I think Dr. Pinty had also mentioned about faith and community leaders. Oftentimes, this is the first point of contact when individuals and families face mental health problems or traumatic events. So to Dr. Pinty and Gallo's point, that is another additional starting point. Again, we do have a lot of work to do as like a community and a society as a whole. The hope would be that faith and community leaders can begin to have these conversations more to, again, decrease the stigma that exists and help get clients into care.
And one thing that I would like to add is and encourage individuals to find the right provider. It's okay if they engage in a conversation with a provider and they decide this isn't a good fit. Ultimately, in order for a person to move towards that journey of recovery and healing, they have to have a positive relationship with the provider or the therapist that they're going to be seeing. And so they have to feel like it is a good fit. It is a right provider. I often say that finding the right therapist is like shopping. And you try it on, and if it doesn't fit, you move on to the next one. It may not necessarily be a great, business models for those providers that are out there. However, it is a great therapy model for people to shop around and find the right therapist that's a good fit. One other thing is a lot of entities, they are not appalled or shocked if you call and say, I'm looking for someone that, is a Spanish background or speaks Spanish, or I'm looking for someone that is African American. I'm looking for someone that is Asian. Like they are used to hearing those questions. So don't be afraid to ask those questions when searching for a therapist. As we come to a close in the panel part of the discussion, and before I open it up for question and answer from our audience, I would like to, hear Dr. Erica, Gallo, Susan, do you have any sort of last messages or most important message you want everyone to leave here with today?
Most
I'll open
important. Gallo, did you want to go?
Just acknowledging that if you're from a different culture, from your client, that this could lead to differences of points of view. That's an obvious, right? And just to consider that if you don't keep this in mind, it could lead to ignoring symptoms that are important to your client. You and your client may have differing ideas about the clinician's role. What do you need the clinician to be? Quiet versus reflecting and giving feedback, right? Or listening to you vent. What are your ideas about the clinician? That needs to be spoken about. Different ideas about how the client should act. Should I be in here screaming, or should I be in here speaking in a particular way? What are my ideas about how I should behave as a client, right? Based on culture. Different ideas about what causes symptoms. We talked about that. And what is acceptable treatment? Again, what do they think is going to work for them? That's so important.
I was going to thank you, Gallo, but I guess a takeaway point is that owning cultural humility skills can really improve healthcare as a whole. So the practice of cultural humility, as well as cultural competency, can really help to create deeper connections and understanding between your clients and providers, which may increase client satisfaction and care outcomes.
I think the one piece, and I mentioned this earlier when we started this conversation, is really recognizing and understanding how institutions and systems are racially discriminatory and oppressive, and its impact on the mental health of our clients. So although they may not be our own lived experiences, we should not invalidate or discount the experiences of our clients. And I think I know Susan and Gallo both echo this in terms of cultural humility, is this creating a space where you're just an ongoing learner of not only just the text stuff, right, but also of the client. So I think just to walk away from today is just recognizing the historical context of where we've come from as a healthcare industry and how there's pretty much continual adverse impacts on the mental health presentations of clients.
Thank you all. I appreciate those takeaway messages. And one thing that I am just consistently hearing over and over between all three of you is just stay open-minded and continue to learn. Do not assume, continue to learn, stay open-minded and build up your comfortability with identifying and having those conversations around culture. Thank you so much. I do see that we have one question in the Q&A. What advice, if any, would you give to future behavioral health providers with multicultural identities?
I would honestly say be transparent and open about what your identities are to clients. I think that one of the features about the Therapeutic Alliance and report is the relationship. And if we're modeling our comfort in our own diverse identities, that will further perpetuate and promote the client's comfortability with their own identity. So that would be I hate saying advice because I don't like giving advice, but if I had one key point, I would say be very transparent about how you yourself identify with clients.
I want to say that reflecting on what you value from each piece of your identity is important, because there is value and there is gems, there's good stuff in every culture. And I think that more than just being open to learning, I think having a genuine interest and really valuing what the person brings, the client brings, all of their culture, all of the differences. I think that's important. I think as a provider, again, to really value your differences and find positive pieces about all of the identities in which you hold, make you, more confident and probably more relatable. And I think also, it can help you work with a client through their own issues regardless of their culture. If you are more defined, if you have been through, and then you can, really value and accept and listen to their experience.
And I was also going to add, I guess, regardless of one's identity or multiple identities, just understanding the societal and cultural influences at play in mental health care, as we've been discussing in our conversation, is really the first step in avoiding harmful misunderstandings, removing obstacles, and encouraging people of all cultures and identities to access the care that they need.
Let's see if we have any more questions. Okay. I'm not seeing any additional questions. I have one piece of takeaway item for the audience. When we begin this session, I asked each of our panelists to define their cultural identities. And you've heard each of them throughout this discussion talk about how it is important to kind of understand your own personal self. If you have not done that exercise yourself, is to just write out, how do you define your cultural identity? I think it would be important and key for you to be able to do that, especially for clinicians and those that are allies and or just interested in this topic or looking to just learn more about it. I also think that in order for you to understand yourself, really think about how do you define your cultural identity from a holistic viewpoint. In order for you to kind of know like where you can help people, where you may be triggered and or where you may also be stuck. It's important that you kind of pause and take a moment to really understand who you are. As indicated without the panelists, it's important that we continue to grow and learn. And this is an important step to becoming culturally competent. And being comfortable in having these conversations is taking that pause to really understand who you are. If you try to write down something and you find yourself not being able to produce, it's okay. Now you know that you have a journey to go on. So that is the one thing that I'm going to ask people to do as you leave this conversation today, is to not just walk away and forget about it, but really take this as a personal opportunity for you to do a deeper dive. I thank all of you for joining our Forge Health panel discussion around cultural identity and mental health. Thank you, Susan, Gallo, and Dr. Erica, for everything that you provided and all the golden nuggets that were dropped today. If you're unfamiliar with Forge Health, please visit our website, forgehealth.com, as well as if you would like to share this video, it will be on our Forge Health YouTube channel for you to post and spread the word. Thanks, everybody, and I hope you all have an awesome rest of your day. Bye.
Thank you.